Previously on Kris and Melanie TV, we spoke with Dr. Ellen Bunch, a family physician in Prescott, Arizona, and she started a very interesting conversation about cholesterol. Let's see what she has to say.
Recently, I completed a fellowship in integrative medicine at the University of Arizona under Dr. Andrew Weil, the guy who looks like Santa Claus.
We love Dr. Weil.
love him. It's
Yes.
wonderful.
And it was a 2-year fellowship, and what they did was, it's available only to medical professionals, not just MDs and DOs, but nurse practitioners, things like that. And they taught us more nutrition. You, believe it or not, don't get nutrition education in med school. So there was a lot of education there, plus how to use vitamins, minerals, supplements to help our bodies help themselves. Being an MD, I do hand out prescriptions when necessary, but it is my preference not to. And the reason is because a prescription interrupts a normal pathway. Okay, so let's say you're taking Lipitor, for example. Even though it's helping with your cholesterol, it's interrupting the cholesterol pathway. And when you interrupt that pathway, things that normally go down that pathway have to go different directions. And when they do that, they cause other problems. And so my philosophy is, why don't we use diet changes, lifestyle changes, to include some forms of exercise and get your body to correct the cholesterol problem on its own.
Because most of the time it does, right?
It absolutely does. It absolutely does. You've got to be strict about what your diet is and what your goals are, but you really can correct this problem with just diet and lifestyle. And the nice thing about that is, not only are you correcting your cholesterol, you are helping to correct your risk of heart disease, diabetes,
Right.
high blood pressure, all kinds of things.
So this is basically addressing inflammation.
Absolutely, absolutely.
Now, I was reading some information that studies were done, and tell me if you agree or disagree. And I thought this was really interesting because they were talking about cholesterol in terms of Alzheimer's. And that these cholesterol lowering drugs are lowering cholesterol so much that it puts us at risk. So it's kind of, they're saying it's okay to have your cholesterol a little bit higher than what the traditional medical model is telling us because it reduces that risk. Is that your belief too?
Absolutely, and there are studies out there now having to do with not only cholesterol levels, optimal for people getting older and to help prevent Alzheimer's, would be a level somewhere between 160 and 200. Now, if you have heart disease, your cardiologist is going to be saying, get your cholesterol as low as it can possibly go. And really, that's not what's best for your brain.
Right.
Now, we've got this big balancing act that we've got to do, because if you have heart disease, we need to pay attention to the kinds of cholesterol. And that's where an expanded cholesterol panel would come in. There are data and studies out there now to say, have you ever heard of the guy who has perfect cholesterol and dropped dead from a heart attack? Okay. Most likely it's because his LDL, which is considered the bad cholesterol, was all composed of the very small clogging kind of LDL and not the large buoyant kind of LDL. There's all this range of LDL sizes. And those small clogging kind go clog blood vessels. So coronary arteries, you have a heart attack, even if your numbers are perfect. So by making dietary changes, you can actually change the size of your LDL cholesterol to make it the more protective kind. And
Is
that's what I
there
work
a
with
test
patients.
that will tell you what size yours are?
Absolutely. It's called an NMR lipoprofile. It's just an expanded cholesterol profile. Most traditional family docs and cardiologists don't order it. Unfortunately, I'd say a lot of traditional docs and cardiologists don't know how to read it. But the information is there, and you can do a lot to change it.
Oh, wonderful.
That's awesome.
Yeah.
This is good news. I mean, this is good news for people to gain this understanding how it can be done completely naturally.
Naturally, and if you think about it, I mean, before we had prescription medications, yes, we had people dying, but not really of heart disease. not high blood pressure, diabetes, all these kinds of things. And that really has more to do with how our diet has changed, how the Western diet has changed how our bodies look, feel, and act. So interestingly, I'm reading a book right now written in the 70s called The Sugar Blues.
Yep.
And you've heard of it?
Yes.
Okay. We've known the impact of sugar and carbohydrates for years, and in fact centuries. The data goes way back into the 1800s and beyond. But our bodies are not equipped really to handle the amount of carbohydrates that we give it. And if we ate more of a traditional diet, some people may call it a paleo type diet. I hate putting a title on any kind of diet, because really it's just about learning to eat right. You know, so it's not diet, bad word.
Well, and it's so critical because we're seeing more and more data too, where we now have children at 12 years of age with the vascular structure of the elderly population. So all of this is happening so much sooner, and it's tragic, and it's 100% related to what these children are eating and the fact that they're not out moving.
I know. I don't know if you guys remember growing up, but I was always outside, and you didn't worry about being taken or anything like that. But kids' diets today, we're seeing more and more obese children, and type 2 diabetes, which traditionally was a diabetes we saw, 50s, 60s.
Yeah.
We're seeing it at 12 years old and sometimes younger. And it just has to do with, unfortunately, sugar and simple carbohydrates, and we're poisoning our bodies that way. Now, on the flip side of that, the pharmaceutical companies are benefiting from this, but yeah. So my approach to basically taking care of a patient is, if we need a prescription to get something under control, I'm all for it initially. But while we're doing that, we're working on making diet changes, getting someone active, even if it's starting with chair yoga, and working our way up, not to where you're just going to the gym 7 days a week, but an active lifestyle to help your body take care of itself.
That's fantastic. I love that.
Some of the best conversations take place behind the scenes. Stay tuned for part 3 with Dr. Ellen Bunch, where we saved the best for last. Then head on over to healthhubnetwork.com to request your free Hub Club Health and Wellness discount card to save on products and services with participating providers.
Blah, blah, ha, ha.
Blah, blah, blah.
Did you do speech therapy too?
Yeah.